Good evening, and welcome to another edition of the Rankin-Mon Valley, Pittsburgh section of the National Council of Negro Women. My name is Alice Paler-Days, Section Political Committee member, and joining me this evening is Valerie Waters, and she's the section member and president of the Pittsburgh Club of the National Association of Negro Business and Professional Women. Our special guest today is Dr. Frank Igwe. He's the founder of Moravia Health. We thank all of you who have participated in our previous programs, and we hope you will join us again today by calling 412-953-9583 with questions and comments. The number will remain on the screen. And I'm introducing my co-host, Valerie Waters.
Thank you, Alice. This program satisfies two of our national mandates: to disseminate information about issues affecting African American women and their families, as well as promoting healthy lifestyles and behaviors through wellness projects. It also helps promote one of our other initiatives, which is to increase good health and eliminate health disparities. We will give you a brief description of Moravia Health before we introduce our guest. Alice, are you going to read the intro or shall I?
I can do that.
All right.
And we'll be showing some photos and descriptions as we read it. C. Frank Igwe, PhD, is the CEO and founder of Moravia Health, which is a full-service Medicare and Medicaid home health agency licensed by the state of Pennsylvania. It is recognized as the premier home health care agency in Pennsylvania. They strive to find the right health care services, nurses, caregivers, and providers, which can be a very scary task, especially when it is your health or the health of a loved one that is at stake. Therefore, Moravia Health is committed to providing safe, sensible, caring, and affordable plans to help people remain at home. Welcome, Dr. Igwe. We thank you for appearing on our program this evening, and we would like to start the program by asking you a few questions. And we'll start off, I think, Valerie, you're starting with your questions.
All right. Dr. Igwe, can you tell us about your decision to establish Moravia Health and how long you've been in operation?
All right. Well, first of all, let me say good evening to Valerie and Alice, and hello to all your viewers out there in the world. Thank you for having me on the show. I want to also say thank you to Cinnamon for connecting us, and this is indeed an honor. Thank you. Moravia Health has been in existence now for 10 years. It's 10 years. It's been a decade. As soon as I said that, I was like, wow, that's been 10 years. Time flies when you're having fun. It all began after I graduated with my PhD. I was in DC for a few years as a business management consultant. I was doing well. I was doing well financially, but I wasn't satisfied emotionally and spiritually. All right. So I always tell people, I begin with the end in mind. What do I mean by that? I always think of the life hereafter, and whenever I meet my creator, what am I going to tell him? And at the time I was a business consultant, my answer would be I taught billion-dollar companies how to save $1 million here or $1 million there. And I didn't think that would be a life well lived. Um, I always wanted to do well by doing good. I wanted to help humanity and have a story to tell. So when my days are done, people could say he lived a life and he lived a life that was worthwhile living. So I quit my job as a business management consultant. I took a year off. And during that time, I really started looking for myself and trying to find out what my passions would be. So after a year and a half, I realized there was a need in our community. It was in healthcare as our family members are aging. Few people realize the services or resources that they have available to them. So my thing was, how do we create a healthcare system where we can deal with people who are low income, educate them and inform them about services that are available to them with the least amount of money that they have to pay for. And that's where Moravia Health came in. This is where the home health space came in. We targeted our target demographic were low income individuals on Medicaid, and we informed them of the services that the state of Pennsylvania had to offer them. And that's a long way of showing how Moravia came about. So it started again in 2012, and by God's grace, we've grown to be the largest home care agency in the state of Pennsylvania.
Oh, really?
Beautiful. Yes.
Yes, yes. Well, can you tell us how you came up with the name Moravia and what does it mean?
Oh, yeah, that's a good question. All right. So if you pay attention to my last question, I told you I took a year off from business
Mm-hmm.
management consultant to find myself. Well, that's only half of the story. I took a year off, but during that year, I created a nonprofit. Its name was City Aces. Aces stands for Athletes Changing Expectations. And what we did was we went from city to city. We'd get the number one football, basketball players in that city. We'd get the mayors, we'd get the governors, and we'd go to middle schools with at-risk youth. And we would hold these huge events where we would bring all the business leaders into the stadium, the auditorium. We'd have 2,000 kids, and we would tout to them the value of education, stay in school, stay out of trouble. So this went on for a year. We went to 10 different cities across America.
Mm.
Our last city was in Baltimore, Maryland, with the Baltimore Ravens. So we're doing our last show. And the middle school we did it on was on a street named Moravia. It was Moravia Road. If you're ever in Philadelphia and you're driving from Philadelphia to Baltimore, you see it. Moravia Road, right off I-95. And as we're doing the last show, I don't know if you picked this up yet, but I'm a man of faith. So I hear the voice in my spirit. Remember the name Moravia. This name is going to make a difference. So I had it in my spirit. And then when I finally came out of the wilderness, so to speak, and I realized I was going to do a home care agency, the voice came back. Remember that name, Moravia. It's time.
Okay. Okay.
And that's where it came from.
Mm-hmm. Mm-hmm. So how is your agency different from other healthcare agencies?
Well, the first thing, to be honest, it always has the founder's blueprint. And I always tell everybody that we hire, be careful that we don't get too arrogant about what we do. Everything we do is by the grace and mercy of God. We're very thankful for that. Right? That's one thing we always have to be very cognizant about, right? Because from the very beginning, from the inception of Moravia Health, God has been in the mix, right? And so as the founder, I try to replicate myself in all of my employees. We're different in the sense that we actually care. Right?
Okay.
Before we stepped on the scene, there were 100 other home care agencies, right? But they didn't have that special sauce because they saw people, they saw clients, they saw consumers, they saw patients as just people with dollar signs above them, right? And so my thing is 80-90% of the people in the home care space, in the low-income home care space, unfortunately are either black or brown people. But the
Yeah.
people were catering to this population didn't really care about this population, right? And so there was an old saying by Tavis Smiley that you can't serve the people if you don't love the people.
Mm.
And so we love our people, we love our community. Everything we do shows that the people I hire have to love our community. You've got to be a nice person. If you're not a nice person, you can't work in Moravia Health. I say there are two things you have to do. You got to be nice and you have to be hardworking. If
Okay.
you've got those two things, I think those are the two things that separate us from the rest of the competition. Right. So there's a lot of imitators of Moravia Health, but there's only one.
Okay. Mm-hmm.
With at Moravia Health, do you have a unique logo? What does it mean?
All right. I don't know if you picked this up. I might have said it only 2 or 3 times, but I am a man of faith, right? So when you see that logo, everybody, if you don't have the logo in front of you, either Google it now or Google it later. It looks like a crest. However, that logo started out as an angel. And now that I've shown it to you, you will see it. You'll see the trunk and you'll see the 2 wings. So when people see it at first, they think it's a plant. It looks like a floral plant. But it actually started out as an angel, which my friend converted to the logo that we have now.
Oh, okay.
Everything has meaning. Nothing happens by chance.
Okay. Mm-hmm.
What is the age of your clientels that you service? When we think of Medicaid and Medicare, is it basically a senior population, or is there a certain age range?
Well, anybody over 18. So we care for the elderly and the disabled. So if you're over 65, you're considered elderly. If you're in the program and you're under 65, between 18 and 65, chances are you have some kind of physical disability. When you go above 65, these are the population, this is the demographics who are usually elderly and who've lost a step or two, and they need someone to come in and just help them do daily activities around the house, cooking, cleaning, running errands, companionship. Below 65, you're usually dealing with individuals who have had some kind of either accident or they have some kind of disability that they were born with. The same holds true for them. Cooking, cleaning, errands, companionship, all of the above is what we do. So to answer your question, 18 and above, anybody over 18, you belong to Moravia Health. And if you're out there listening and you're above 18, I expect you to call your agency, your service coordinator, and tell them to transfer to Moravia Health tonight, or if not tomorrow morning, first thing.
So then, if you're under 65, you would have to have some type of disability, mental or physically.
Physical. The health space it's a broad spectrum. We focus on a very thin sliver, very specific sliver of that spectrum. We deal with people in the Medicaid waiver program. Under 65, you tend to have some kind of physical disability. There are other waivers that focus on mental disabilities. But our niche, so to speak, is just those who are either elderly or have some kind of physical disability.
Okay. So do you provide in-home care, or do you provide homes for them?
In-home care.
In-home care.
So we don't actually own the homes. We actually provide the aides who go into people's homes. And let me expound on that, because there's 2 tracks to this. I would say around 85% of our population are people who come with their own home care aides. And let me explain that. The Medicaid waiver program in Pennsylvania, they realized as the population ages, and even people who are at home with disabilities, a lot of us are taking care of our family members without getting. That's where the Medicaid waiver program comes from. And that's how we convert people who may not know this service exists. We tell them, you're taking care of granny anyway. You're taking care of your mom anyway. Why don't you get paid to take care of your mother,
Mhm.
right? So 85% of our people are people who the client already knows or is familiar with.
Okay.
And we just hire them to come on Moravia Health as a home care aide.
Oh,
And we
well.
pay them to do what they're doing for free anyway. Now,
Mhm.
the other 15% are people who may not have anybody. If that's the case, then we send out a Moravia trained aide to go out there and take care of people who may not have somebody readily handy to take care of them.
So someone who's listening now, taking care of an elderly relative, can call you.
You need to call me like tomorrow or yesterday or
Oh,
Monday, whatever comes first. They need to call us because the first part of our business, this is why we grew so quickly. This is why we grew to be the biggest home care agency in Pennsylvania. Was it was education, right? Because you're talking to our people. The hardest part for us was convincing people that this was free. We're telling you, you're taking care of your mom without getting. There's a program that you can enroll in, and I always would tell people, if you give me these next 3 to 6 months to enroll your mother, I will give you the rest of your life, right? So you give me 3 to 6 months to get me through this enrollment period. It's going to help your mother. It's going to take an economic burden off you and your family, because all of a sudden you're getting money coming in as an employee. You have a full-time job that supports you and supports the rest of your household. That's what we call win-win.
mhm.
Yes, so someone in our audience here in Pittsburgh, should they dial your number? I That's what I was looking down at. I don't want to give the incorrect number.
Yeah, absolutely. I believe the number, see, we have 10 different locations across Pennsylvania. If you're in Pittsburgh, dial 412-800-2222. That's 412-800-2222. Or Google us. We're not hard to find. Google Moravia Health.
All
Okay.
right then. Thank you. I just wanted, that's why I was looking down to get the number
Right,
to share. And the
right.
name of the program again, if you're already a companion to a relative, is there a
Well,
specific?
if you know anybody on Medicaid, right? I mean, that's the first step. There's a two-step equation. If you're on Medicaid, and if you have some kind of disability, those are the two things. And disability can be anything. Diabetes qualifies as a disability. Hypertension qualifies as a disability. Blindness is considered a disability. And this is where we have to educate people, because a lot of people don't realize that there's 10,000 different categories of disability.
Mhm.
And this is where we help get you situated, right? So if you're on Medicaid or you know somebody who is, give us a call. We'll try to get you enrolled. We'll go through the process. It takes 3 to 6 months. And after it's all said and done, you can call me after you're all enrolled and thank me.
Okay. Mhm.
I think so. You don't provide live-in care to your clientele, or
Well,
do you?
you could say yes, we do, because like I said before, 85% of the people are already in the house. If they're not related, if they're not already connected before they come here, we don't send an aide to stay at somebody else's house 24 hours a day, 7 days a week. We do it in shifts. But like I said, a lot of times the people who actually come in are daughters or sons or nephews and nieces,
Mhm.
so they already live in the house. So I
Okay.
guess you could say de facto, yes, that is living care.
Well, you're multiple shift care. Does that include weekends and holidays?
Oh yeah, yeah. We're not going to leave you abandoned. We're dealing with a vulnerable population. Believe us, if we're here, we're not going to leave you alone.
Okay. Mhm. Mhm. Okay. So I think the next question is about your cost.
Well, I'm sorry,
Hmm.
we're not permitted to discuss specific costs, but
Hmm.
is there a service that's affordable if you do not have Medicare or Medicaid?
Well, remember what I told you. It's such a wide niche. What you're talking about here is what they call private pay. If you're not on Medicare or Medicaid, you come to our agency. Well, we actually don't do it. You would go to another home care agency and pay them out of pocket. It can get expensive. The population we serve, as I said earlier, is low income because those were the people we saw that were most vulnerable and most in need. Um, I'm not going to give you the numbers here if you don't want them, but they can get expensive after some time. They're not cheap. But our population, if you're on Medicaid, for you, it's all free. It's a government state program. That's
Oh, okay. Now, do you provide temporary care and long terms? For instance, if I've had surgery, I have a disability, I've had surgery, and I'm home, and I need some short term care. I need someone to come in for maybe like 6 weeks or 2 months, or you provide that service.
The answer is yes. The answer is yes. But don't forget, even though the answer is yes, there's still an enrollment process.
Right.
So if you're already enrolled in the service, we can start you today. But if you come to us and you need short-term care, but you're not enrolled in the service, then we would enroll you and get you situated.
Oh, okay. Mm-hmm.
Does your staff perform assessments with with activities of the daily living, such as how well you can eat, bathe, or any other movement? The 5 ADL assessment, is that what Moravia performs?
Well, we're getting into the weeds of how this thing goes. There's Moravia Health, but they're what you call service coordination agencies, who are part of the agencies who enroll the client. All right. So when we talk about enrolling the client into new services, you take them to what they call service coordination agencies. These are the people who come out and they do the assessment and they check all the ADLs, activities of daily living. So they would see if Mr. Johnson, is he able to cook? Is he able to clean? Does he need help with running errands? And they go through a whole list of things that you may need help with. And based on their assessments of these ADLs, that results in the number of hours they may give you a week. So if you run into somebody who is completely helpless, they may get 168 hours a week of care. That's 24 hours a day, 7 days a week. If they come and see Miss Terrell, she can do most things by herself. She doesn't need 168 hours a week. She could get by with 56 hours a week, which is 8 hours of help a day. So short answer, the service coordination agency is the one who does the assessment of the ADLs. And once they do the assessment, they come back to us and they come back to the consumer and they say you get X amount of hours a week to utilize.
Mm-hmm. Now you have staff that provide custodial services such as assistance with dressing, bathing, medication reminders, and do errands and shopping for the clients. Now, what type of training do you provide for them?
Well, we have an entire training division. Oftentimes, we're in the like I said, we're in the non-skilled sector of home care. So a lot of things that we do is already common knowledge. There are 13 categories that the state says you have to train people on. So our training it's a 10-hour course that you can do over the course of a week. We're just implementing like a whole new system now where it's all going to be electronic and it's going to be remote. We have a whole training agency that we're bringing in. You watch the videos, you take the tests. To be qualified as a caregiver, you have to have at least an 80% on the test to pass. But you get thorough training before you actually start caring for the client.
Oh, okay.
All right. We have a caller waiting on the line. Caller, would you identify yourself by your first name and your location?
Hi, yes, my name's Cinnamon Copridge, and I am an employee for Moravia Health representing the Pittsburgh branch. How's everyone doing this evening?
Good.
Hey, Sin.
Hi, how y'all doing this evening?
Very good.
Great. I just wanted to call in and represent for not only myself in Pittsburgh, but Moravia Health. I just welcome Dr. Frank Ewey giving me an opportunity to be an employee with him. He's more like family now. And on Alice asked a very good question earlier. What makes Moravia stand out from other home care agencies? Mm-hmm. I've been in the home care field since I was 16 years old. I'm now 43-year-old young woman, and I must say that they actually care, and it's a difference. And that made me want to be able to be compatible, and it was an excellent fit and a compatible fit on both ends. That meaning that when I go into these places, and I'm one of the outreach people for the Pittsburgh branch, these are people that I see in Walmart, Target, Giant Eagles, and I'm not selling them a dream, that I'm showing them that Moravia Health is not only here to help you, but to take you in like a family, and it's a difference. You know, when you see a person like Frank was mentioning earlier, it's just not about a dollar sign, or if we can just add them onto our payroll. We treat them like family, and I love the intimacy of a family-orientated company, and I just love working for them. We're growing in Pittsburgh once again. If you want to get any type of care, I work in outreach personally. You can reach me at 412-800-2222. I will come to you if you need me to. We're about filling in and making people feel welcome. And Frank, welcome to Pittsburgh.
Thank you, Sam. Thank you, Sam.
That's fantastic. What a great testimony about Moravia.
Yeah, Cinnamon's like my sister. I mean, as soon as she came on, it was a natural fit. You know how sometimes when someone comes to the office and they're like, I'm home. I'm home. That's how it was with Sin. As soon as I saw her, I was like, you're Moravia material, Sin. I need you here. And it was like a duck taking the water. It was like, she's home. This is what we've been missing.
Oh, okay. Very good. That was very nice.
Yes. I think you addressed this, Dr. Igwe, but do you provide hospice service, since you provide you provide round the clock service, but what about in-home hospice?
That again, that's another area of health. I mean, it's a specialized area of healthcare. It's not something that we actually do here. Basically, because I'm too emotional. I mean, I get attached to these clients. I can't sit there. I don't know if I can. My heart can't take it. But even if we wanted to get in that space, it's a whole different spectrum. It takes a whole different set of skills training. And just knowing how attached I get to the clients, I wouldn't be able to do it. I couldn't watch. Couldn't do it.
Well, do you provide breaks for family members who are caregivers and they may need to take a week off or a week's vacation?
You absolutely. We have people for them. We do have paid vacation, paid holidays. Like I said, this is family. It's not about a dollar sign for us. We want to make your stay and your family member who's with us. We hope they have another 100 years. But for whatever time they have left here on earth, we want to make that time with us as comfortable as possible. And that includes taking care of their family members who are taking care of them.
Oh, okay, good.
So you provide the respite care for the caregiver for 2 hours, 1 week, 1 month?
As long as they need.
All right, good. That's good.
By the way, this is a Black-owned company, right? And so we also do this to make us all proud. So it's like when people realize, you know, it is a Black-owned company, because a lot of times unfortunately, people have stereotypes of Black companies, right? So when they finally come in and they see the people behind the name Moravia, and they realize, wow, these people look just like us. There's nothing like the pride that crosses their face when they see, you know, this is what it looks like when we're given an opportunity.
Well, how do you ensure that all your employees are compassionate caregivers, and particularly when dealing with a person that's terminal?
Well, there's this thing that they call agency choice, right? So remember, there's two buckets, there's two classes of consumers. There are people who come in with their own caregivers. 85%, 85% of the clients come with their own. So they make the choice. We we furnish 15% of people who may not have home care aides. That's where we have control. Because if Ms. Jones comes in and she tells us, I want my nephew to take care of, at that point, you can't tell her, no, Ms. Jones, we don't want your nephew. Here's a Moravia aid. You're going to take it and like it. We don't do that. We believe they've been together for 30, 40 years. She knows what's best for her. She knows what makes her comfortable. So we often, we acquiesce to whatever she issues. But our aides that we hire, they go through a rigorous interviewing process. We have a quality assurance team who reaches out to the client, and we do constant satisfaction surveys. Are you happy with the aid that we've sent? Are you guys compatible, or are there things that need to be changed? We need to find somebody else. Oftentimes the answer is yes, I like who you sent. If it's not, then we'll find somebody else until the fit is just right.
So when a person comes with their own caregiver, which is probably a relative, do you offer training to them? Are they receptive? And they're receptive to?
Yeah, and that's the beauty of this whole thing. After it's all said and done, we've given them a new skill set. After they've gone through the training, they get certificates and certifications. So even if they're not with Moravia, they can always, for the rest of their life, go out and find work as a caregiver.
Okay, that's good.
So this whole thing, it gets deep, because I really believe, and I mean this with all sincerity, if we're going to transform our community, it starts with capital, right? So if we can give people transferable skills, right? It's not just about money on the front end. We're giving you a skill that you can take with you for the rest of your life.
Anywhere you go.
Yes, that's fantastic. So you do perform comprehensive background and criminal checks on your potential employees?
We do. 100%. Now, you ladies keep taking me down a different road, but I'll go there with you. I'm gonna walk that road with you. Because now we're getting into the deeper things. We start getting into the prison industrial complex. How a lot of us are in jail for petty crimes that now they're making money off. I'm talking about marijuana. The prison is full of people who have tiny amounts of marijuana, and now people are selling them for a profit. That's a different story. What I'm saying is this: when it comes to people who pick their own aides, sometimes they do come back with criminal background checks for petty things, like using marijuana, for example. There is a waiver option that the client can sign, that they take on responsibility for their relative, that they say, even though this person has a criminal background, I still want this person hired as my caregiver, right? So what does this do for our community, which is disproportionately locked up? All of a sudden, you've got someone who couldn't find work because other people are saying, we're not going to hire you. Now he can be an employee for his mother and build up his work history, right? So these petty offenses that he had when he was 16 years old and he's now 45, they don't preclude him from making a living for him and his family. Now, that only pertains to people who are family members or relatives. If they are Moravia Health assigned aides, that's a whole different kettle of fish. That one, we can't send, unfortunately, we can't send people with, if anything comes back, we don't feel comfortable sending them into strangers' homes that they may not.
Right. Mm-hmm. Now, is your agency?
Did that answer your question? Does it make sense?
Yes, it does.
Okay.
Now, is your agency licensed, bonded, and insured?
All of the above, yes. And we are accredited by the Joint Commission. The Joint Commission represents the best in class, right? So when it comes to home care agency, that's almost like the seal of approval. Only 1% of agencies have that. It's hospital level. What's a hospital down there in Pittsburgh, University of Pittsburgh? Is that the hospital system y'all have down here? Down there?
UPMC, yes.
UPMC.
UPMC.
All right, so down in Philly, it's Penn Medicine. All these facilities have Joint Commission level accreditation. That's the level of accreditation Moravia Health has here. Only 1% of agencies have it, and we're proud to say that we're one of them.
Oh, okay. Good for you.
You
Black
talked about.
excellence.
Oh, I'm sorry.
Black
Does your
excellence.
does your agency accept clients who may have Alzheimer's, dementia, or other special needs persons?
Absolutely. Absolutely. Now, some of these cases, especially if they have Alzheimer's or dementia, it's our services coupled with more specialized services. What do I mean by that? There's typically another agency with more skilled training to deal with people who may have dementia, who may wander out at night. Our services are basic things around the house, such as, and I've said it before, the ADLs, cooking, cleaning, things that don't require as much skill as taking care of somebody who may need a higher level of medical attention, such as dementia or Alzheimer's. So oftentimes we're partners in this with other agencies or with the hospital system who may have the nurse coming in every day to do checks.
Oh, okay.
Right.
And provide medicine. Who provides the medication that patient might need? Your staff or the nurses?
The nurses do that. Our staff is allowed to give medication reminders, but these people aren't trained in medicine, so they can't actually administer the medication because you must be a nurse. You must be either a nurse or a certified nursing assistant to have that level of clearance to give people medicine. Mm-hmm. However, our aides do know the medication that the client takes and their schedule. You can give them reminders. Ms. Jones, it's time to take your medicine, but you can't actually administer that medicine.
Oh, all right. Mm-hmm.
Yeah.
Okay. Now, and I understand too that that your staff go to the doctors with your clients. Now, do they use their own personal cars, or do they accompany them on access or some other form of transportation?
The answer is yes. All of the above. Right.
They can use their own personal cars to transport.
If they do, there has to be a waiver, right? Because Moravia Health, again, it's one of those things that the client has to agree that if anything happens. They have to have insurance, first of all, insurance and a valid license, and the client has to agree that they're okay riding in this person's car.
Oh, okay.
So there's a waiver that the client has to sign. If they don't sign that waiver, then it's not permissible to use the aid car, but they can accompany them on the public transport system if necessary.
Oh, okay. Mm-hmm.
Right.
Okay. Mm-hmm.
What safeguards does your agency have in place to protect your staff from being exposed to COVID-19 when working with clients?
Wow, let me tell you, COVID hit us hard. And when I say us, I'm not talking about Moravia, I'm talking about the entire industry. Right now, we do have to have testing of the aids before they go in. We still have gloves and masks and hand sanitizer, all the PPE, the personal protective equipment that's necessary. But the greatest thing we have going for us is testing. As soon as you feel symptoms, they have to either call the office or we have a clocking app that they can use and they report it to the office that they're feeling symptoms. And we keep them far away from the clients if that's the case.
Mm.
So did COVID affect your agency financially?
I think it affected everybody. For the home care space, it actually had an opposite effect. Because if you remember, when COVID first hit, most people forget this, but it was in Seattle. Do you remember the first cases of COVID where they happened? They happened in a nursing home, if you recall the very first cases. And so there was a rush to get family members out of nursing homes and back home.
Back home. Yes.
Do
Yes.
you remember if you Google it? I
Yes.
mean, I'm working in encyclopedia. That's what I'm famous for. The first ones happened in Seattle, and it happened in nursing homes. So you'd have nursing homes with 30 people, and 28, 29 of them died. And this was happening in each nursing home across the land. And so when
Yeah.
people started
Yeah.
seeing that, they were like, let's get family members out. So people actually left nursing homes and came back home, which drove up the demand for home care. So in that sense,
Yes. Yes.
yeah. But
Now you
it
provide.
affected us in the sense that before COVID hit, you could have one aide who could service 2 or 3 people, right? You work 3 hours,
Mhm.
at Dr. Terrell's house, 3 hours at Dr. Phil's house. You could rotate one aide with 2 or 3 different households. After
Yeah.
COVID hit, none of that. It was a one-to-one relationship, right? So we couldn't afford to have one aide go to one house and expose themselves with 2 or 3 different
Then go
clients.
to.
So
Yeah.
it all went one to one, and then that really threw our overtime rates through the roof. Because now instead of working 30 hours at one house, you would have to have that one person work one on one with that client. So instead of working 30 hours, she's now working 45 or 50 with the
Mhm.
same client to prevent them from going from house to house to house to house to house.
Mm.
What is the difference between skilled and unskilled medical care?
Well, I think we've kind of touched that already. Skilled care is exactly what the word says. We talked about it with medication reminders a few minutes ago.
Mhm.
Skilled care requires a nurse, it
Yeah.
requires a doctor. It's not the mundane tasks that we've talked about with the ADLs. It's more specialized. You have to get a doctor's script. Um, your doctor has to sign off on everything that you do. Um, it's more intense. It's a lot. It's almost like being in the hospital but at home. It's
Mhm.
more
Oh, okay.
invasive. Yeah,
So
and that's
does
where the word skilled comes from. Because
Mhm.
it takes
so
specialization.
you provide medical social services
We
or
do
or
provide social
sometimes?
services. Um, we don't necessarily do medical because, like I said, it takes a higher order of training to do that.
Training
Now,
to
let me
do that.
say
Yes.
we are licensed. We are licensed to do skilled care. However,
Okay.
we made a conscious decision to put our skilled license to the side and
Mm-hmm.
focus strictly on the unskilled portion
Oh, okay.
of our
Okay.
industry. So even though we do have that license, skilled, of course, includes physical therapy. It includes speech therapy. It includes occupational therapy. It includes wound care. It includes nursing visits. So even though we have
All
that,
of that.
we have the ability to,
You have the ability to do that.
but we may, because we have 2 licenses that
Okay.
operate side by side, the skilled
Okay.
license and the non-skilled license. We
Mm-hmm.
consciously made a decision, take away the skilled, let's just focus on the non-skilled side of this.
Okay.
If I have a loved one who I think that I want to provide home health services to, how do I get started?
First thing you do is call us.
Call you. All right.
Call for the enrollment department. That's the first thing you do. Before we even get here, let me finish with the social services. Like I said, Alice, to answer your question, there was one word there that was key. You mentioned medical social services.
Mm-hmm.
We don't do medical, but if you remember what I said, we do provide social services,
Mm-hmm.
not necessarily medical.
Medical. Okay.
We do have a nonprofit, and everybody's out there. If you would just go check it out, it's called MoraviaCares.org. This is a philanthropic social services arm of Moravia Health. We give out food, we feed the community.
Oh.
Book bags when it's time to go back to school. We give out hand sanitizers. We do the most good. Like I keep telling people, this is FUBU for us, by us. It's like we do this for the community. We give back. So this is a social services arm of what we do. And also, you can make the argument that the enrollment that we don't get paid to enroll people. The
Mm-hmm.
enrollment that we do to enroll our consumers in the services are really an act of love, but
Mm-hmm.
it is a social service that we do to get as many people enrolled in the system as we can.
Now, where are you located?
Everywhere in Pennsylvania, everywhere. I'm
You're
not saying
statewide.
we're statewide. We're in Pittsburgh. We're in Philadelphia, of course, Reading, Allentown, Scranton, Erie,
Oh,
Harrisburg. Oh yeah, we're everywhere.
so where are you located in Pittsburgh? If I needed your assistance, how could I find you?
Well, first of all, use the number, but we would use the what is it? It's I'm not so familiar with the Philadelphia with the Pittsburgh address.
412 412
Yeah, but
Oh,
yeah, but I'm trying to get the physical address. It's downtown.
It's
It's
downtown Pittsburgh.
skyscrapers. Could you Google where our address in Pittsburgh, please? I'm gonna get that to everybody. It's right downtown. We're in the skyscraper. Um,
Oh, okay.
yeah, Pittsburgh is beautiful, by the way. It's a beautiful city. Um,
Yeah.
but yeah, so you would call the number, and like we're right in the middle
And
of
you
it.
would take it from there. Okay. Okay. And I think we have some pictures to show, Valerie.
yes. Gladys, if you, before we thank our guests for appearing on our program, again, we would like to say that Good Health Wins, Immunization Network, Good Health Wins, is our commitment to building an army of good health champions who understand the importance of immunization across the lifespans. We want to educate, advocate, and impact families and communities across the United States to end the pandemic, address health disparities, and shine the light on the importance of good health through our network of trusted messengers and grassroots activities. Our goal is to increase vaccination rates, help remove barriers, and increase access to vaccination because good health wins. Vaccinate your family. We have one more slide coming up. If you're interested in membership with the National Council of Negro Women, feel free to call 412-897-9641. That's 412-897-9641. It was previously mentioned, I'm the president of the Pittsburgh Club of the National Association of Negro Business and Professional Women's Club. And you can reach us at 412-405-1213 or at our email address, nanbpwcpittsburgh@gmail.com. Thank you, Alice.
You're welcome. And we would also like to thank you so much, Dr. Eby, for taking the time out of your busy schedule to present information on Moravia Health Agency. We also thank all of you for tuning in, and remember our live program airs the first Friday of every month at 6 p.m. This month's program had to be changed due to conflict. And Dr. Eby, your information was excellent. And I'm a senior citizen, so if I ever need some assistance,
No,
we'll call your agency.
you know. 239 4th Avenue. Cinnamon just sent me a text.
239 4th Avenue in Pittsburgh. That's downtown Pittsburgh. Oh, and your hours?
Monday through Friday, 9 to 5. But if you call at any time and leave a voicemail, somebody will get back with you within 24 hours.
Okay, very good. We'll give the number again, the phone number.
Yes.
412-800-2222.
Oh, okay.
Thank you for your service to the community in educating your employees and the community service that you're providing with Moravian Cares. Very impressive. And you are also very impressive.
Thank you. Thank you. It
Yes.
means a lot. Thank you so much.
Yes.
It's been
Thank you
great.
for coming on.
Yes. Thank you.
Yes. Yes. And you provide services to people that it doesn't have to be medical issues, like if they have a disability.
If they're on Medicaid and they have any kind of physical disability, or if they're elderly, give us a call. We'll work it out. Even if it's not with us, we'll figure out where to put you. But it is going to be with us. But we'll
Okay.
take care of it.
Okay.
Ask for the enrollment group.
Okay. Good. 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 But we thank you again for giving up your precious time, because I know you're busy, and coming on the show to share your information about your agency.
It's been a pleasure. Thank you so much. Thank you
Yes.
for such
Thank
gracious.
you.
Thank you so much.
Mhm, mhm.